What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have a guest who really does not need an intro, because if you've been following and listening to my banter for the last couple years, you know that this pharmacist in particular has had a huge impact, not only on my clinical practice, but me as a practitioner, as well as my training academy and all the mentorship and really cool things that I get to do in longevity medicine. I tell him all the time when he asks me what are my goals, and I always say I want to do cool shit and then teach on it. He thought I was kidding, and no, I think the longer that he gets to know me, he knows that I am dead serious. So, without further commentary, I'm gonna introduce Leonard Pastrana. He's a pharmacist. He is the kind of the brain man mastermind behind the nuBioAge company, where they formulate different nutraceutical supplements, as well as bringing together a network of practitioners who all have one vision in mind, and it's to break healthcare and change the industry. Those are some big shoes, Leonard. Like, I need to be like the professional hype person is what I think. But all right, you ready?
I'm ready. You
all
are
right.
A great hype man.
I know. Okay. So first of all, we had Calm, right? I say we had Calm as if I had a part of it. I was there. Let's talk about let's recap. What did you think of Calm?
Calm was amazing. It was better than I could have expected. You have a vision about how an event can happen. You have a vision about how the attendees will take that event. You have a vision of how the exhibitors will be there and how everybody will collaborate. And you're just hoping that it turns into this kind of movement. And it's just a vision until it actually happens. And I really felt like it happened. We had such a great time, a lot of momentum coming out of there. So many practitioners coming out of there with things that they can use in their practice Monday morning. And it was better than I could imagine. And that's not what you think is going to happen when you're planning an event. So many things can go wrong, but we just had so much fun. We learned so much, and everybody's applying that now, which is the fun part and what we'd love to see.
Yeah. So if you're new to this podcast and you don't know what Calm is the clinical application of longevity medicine. So this was a conference that was put on in Miami in February, and I got the fortunate opportunity to be a part of it, along with some really amazing speakers, many of which have all been guests on my podcast, and I get the privilege to call them friends of mine. So that's kind of where we were just at. He also recently rolled out a new nutraceutical in their kind of formulary, which we're going to talk about today. So this compound is called Regenatides. What's great about it being a nutraceutical is that you don't need a prescription to get it, which I think is always nice for patients to have that accessibility. But Regenatides is a combination of two of our favorite regenerative medicine peptides. One is BPC-157, and they paired it with TB4 Frag. So Leonard, do you want to talk a little bit about why BPC-157?
Sure. So one of the most popular peptides, on the planet is BPC-157. It's used in so many different ways, anything from gut health to pain and inflammation, recovery. And so one of the things that we were always thinking about is, well, how do we maximize any peptide or anything that we're doing? Like, how do we add exercise to it? How do we add different lifestyle modifications to it? Is there anything else that you can add to the compound that can make it synergistic? And so, as you know, we have our other supplement called Peptides, which is a combination of BPC and KPV, really doubling down on the synergistic effect of what happens in gut health and inflammatory and immune dysregulation. Well, BPC is also used a lot in inflammation, pain, regenerative, post-surgical, recovering from injuries. And so BPC has this, very prolific effect in many different ways. And so when we were thinking more about regenerative medicine or recovering from pain or inflammation or injury, thinking about what was the best thing to pair that with, and that would be, TB4 Frag, right? So TB4 Frag, if it sounds familiar, it's a fragment of that bigger 43 amino acid peptide called thymosin beta-4, which at some points you can see in like compounding pharmacies. But there's a fragment of that peptide that is just 4 amino acids that's orally bioavailable, that works more on the anti-fibrotic, anti-inflammatory impact of that fragment. And so it's a smaller peptide, TB4 Frag, and it's just a perfect combination with what BPC is doing. BPC is doing all that anti-inflammatory effect. It is improving a number of things when it comes to pain and improving blood flow and improving nutrient delivery, improving cell migration. BPC improves growth hormone receptor density, all these things that you need for healing and recovery. Or the thymosin beta-4 aspect of it, or the fragment, doubles down on a lot of those pathways, but it also has a more pronounced effect on that anti-fibrotic effect, right? So when people have these injuries, and they have these injuries that are lingering or chronic, and they tend to develop into more fibrosis or more stiffness, from not recovering from that injuries, this is where TB4 Frag really kind of shines, and having that anti-fibrotic effect and really improving tissue. And so putting these two together is really impactful now when we're looking to use BPC in this format of regenerative medicine. And so I'm really excited to put this one out. It was probably a long time coming. But we're already seeing pretty tremendous results, and I'm really excited to hear about how you're using it. You're using it in even more unique ways that make sense mechanistically, but really interested to hear more about how you're using it and some of your colleagues are using it.
Absolutely. And I always love sharing kind of how we do things in practice with you, only because, in our practice, I'm very fortunate. I have 5 amazing nurse practitioners that I have the opportunity to work with. So it's like, we kind of do things a certain way, but it's always great to kind of collaborate with other practitioners on how they're doing it. Can you explain a little bit about why oral peptides?
Sure. So you don't typically see oral peptides, right? I'll be honest with you, most peptides are going to be injectable, that you don't have very many peptides that are orally bioavailable. What makes them very unique is just their accessibility to so many more people, right? Also, when it comes to cost. So whenever we find any peptides that have oral bioavailability, or if there's anything that we can do to them to improve their oral bioavailability, it's just a really huge win for everybody, especially the consumer, especially the patient. So very few of these, right? I think I see some peptides that are being attempted to use orally, but we know that that's just not working. So lorazepam is a really good example of another one that is more prescription based, but is orally bioavailable. BPC is probably the most commonly known. And here's another option in TB4 Frag, where it's only 4 amino acids, where we can see a pretty great effect. And one of the things that we do to improve the bioavailability, or not just us, but even pharmaceutical companies do to improve the bioavailability of oral peptides, is they use something called SNAC that improves that oral bioavailability. So SNAC is something that's used in, let me be very careful because they're very litigious, in Rybelsus, that is oral semaglutide, where they improve the oral bioavailability. They use things like SNAC for peptide delivery. And so that's another thing that we can do to improve the bioavailability.
Yeah, I love that. So when we think about in our practice, some of our regenerative medicine protocols, so a lot of times we're layering, BPC-157 with TB4. Back in the day when we had AOD injectable, that was some good stuff. Back in the day when we had injectable GHKCU, we would layer that as like a trio for our hair procedures and our hair protocols. So what I love about this is it fits very well into all the things that we do, in that, we do a lot of gut health. I tell Leonard literally forever, it starts in the gut, and he's like, that's bullshit. I'm like, okay. So that 15-chain amino acid is amazing. Unfortunately, BPC injectable is not available. There's PDA, but we're a big practice of users of BPC-157 and then Peptides. And now we have this other amazing option. So just walking through how I use it in clinical practice. So literally, day one, I was at the conference texting my practice manager, like, I need you to get this Regenatides, get me like 24 bottles of it. Let's just see how it goes. And it's just like boom, 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 because it has so many use cases. So thinking about our MSK, so our musculoskeletal patients, I could see patients using this kind of leading up to a PRP procedure. Because I always say PRP is only as good as what your body is going to have it in. So hydration, nutrition, inflammation, all these other things. And so BPC is like priming the system for the most optimal octane jet fuel that you can put in this machine. On the aesthetic side, my aesthetic nurse and I, Carmen, we do a lot just in our practice. We have a lot of people who want natural aesthetic results. They don't want a bunch of artificial things in their face, which, listen, I'm not here to judge. I got some nice, good stuff in my face. But we have a lot of patients who are utilizing PRP for under eye tear trough restoration. We are utilizing it for microneedling. I use it in sexual wellness for the O shot and the P shot, and I am, trained and certified to use those words. So I am an O shot and P shot provider. But where I see this fitting really in is thinking about our hair procedures, our microneedling procedures, our MSK, and our easy gel procedures. Treating the patient 2 weeks prior to one of these procedures is great because, again, you're really reducing the inflammation, you're increasing VEGF, you're improving angiogenesis, which is going to improve nitric oxide, which means you're going to improve blood flow to the area. It's going to help their body build that nice, beautiful fibrin matrix that's going to build collagen. And that's the name of the game when we talk about anti-aging and aesthetics and regenerative aesthetics. You got to build some collagen to build back that nice meshwork that's going to hold stuff up so your jowls aren't on the ground. So in our protocol, kind of how we're starting out, and Carmen and I are still building it, but like we've put our education, we're big on education. You know this, Leonard. We're big on education. So we're putting it like, okay, 2 weeks before the procedure, we're getting all the inflammatories out of their diet. We're really making sure that they're cleaning up a lot of their stuff. And then we're putting them on 1 capsule of Regenatides every day for 2 weeks. And then after the procedure, they're going to go home on it until the bottle runs out. So it's like another 2 weeks. So it's kind of like we primed going in, did the procedure. Now we're going to help with recovery. So we're going to give them another 2 weeks of it and then see how they do. And then when they come back in, another, depending on what we're doing, another protocol. Okay. You know the drill, 2 weeks before, 2 weeks after. So I think if you are a practitioner and you're into aesthetics, longevity medicine, MSK, wellness, functional medicine, it's like, why would you not use this product? It's awesome. It's awesome. So it's great. It fits very well in all the stuff I do. So and if you look at our shelf here, we've got BPC-157, then we've got Peptides, now we've got Regenatides, and then it's like Lucinergy, and then it's like citronol. So they all got their whole row together. But yes, Regenatides, I think, is one of those, it's like, why would you not? It's like, why would you not kind of do it? So I think it's a great peptide. We've been using it now since we've been back from Calm, and I think we're already ready to order another batch. So looks good. All right.
That's great. That's great. I'm always very hesitant when new things come out because there's a difference between, mechanistically what's supposed to work and on paper what's supposed to work and what we see, in some of the research and what's actually happening out there. And I'll tell you that I am very surprised so far by some of the feedback that we've gotten. And I'm always very, very suspicious about these things because, I've just seen a lot, right? And I've had some of the best testimonials lately, or especially people just within our staff that have been taking it. People with shoulder injuries playing tennis where the pain's going away. And I don't like to over exaggerate it a lot, but I'm seeing some of the best just testimonials lately of people using this, and it's really making a big difference when it comes to pain and how well they can recover. So I'm really excited about it. I was excited. There's a difference between being excited about the science and what it's doing, and synergistically, hey, this makes a lot of sense. But then when you actually see what it's doing to people and helping them exercise better and getting rid of some of the pain that's been nagging them, that's when you start to get really excited, and that's what's been happening lately. So I'm excited that you're having great results as well.
Yeah, no, it's been good again. Like I feel like for us and all the things that we do, it just makes sense, Perfect. All right. So moving on just a little bit, longevity medicine, the certification. Let's talk about this because we had to keep it under wraps for a while, which you are terrible at keeping a secret, and I am just as terrible at keeping a secret. So it was killing both of us.
Yeah.
Talk about it. So you unleashed it at Calm. What is it? Who's it for? How does it work? How do people do it?
Sure. So it's the clinical application of longevity medicine, very similar to our the event. And what we wanted to put together is bring some of the best providers, medical practitioners that are practicing clinical longevity medicine. And so we put together a certification course that goes through exactly that. What is the difference between longevity medicine and the clinical application of longevity medicine? And of course, longevity medicine is not just dealing with how long you're going to live, but it's dealing with your quality of life or your health span. And going through with providers, how do you do that? How do you do that clinically? And, this is a very big subject, right? So it's basically all of medicine. So it's nothing that can be taught in one course. But what we wanted to do is start the framework around what are the most important things that we can, like, where do we start? Where do we give providers a framework that they can follow? And of course, cardiovascular disease or cardiometabolic health is the number one killer, right? And so we created a clinical longevity certification course, part one, that focuses on cardiometabolic health or cardiometabolic optimization. And so we're not just talking about cholesterol and body composition and losing weight. When it comes to cardiovascular disease or metabolism, you have to address, like you always tell me and hammer in, you have to address the gut, you have to address immune dysregulation, you have to address pain and inflammation, you have to address stress and sleep management, you have to address exercise capacity and body composition. And so we put together this framework where we brought some of the best experts that we know, that we've learned from, that we've taught side by side. And we really go in and talk about not only how we identify risk, what are the diagnostics that we're using, how are we analyzing and pivoting treatment plans, and analyzing risk, but what are the protocols that they're actually using. And so we put this certification course together and we launched it at Calm. Super exciting. And what we did with this that's different is that, and we've taken a number of certification courses, and I've taught a number of certification courses before. What we wanted to do here is we wanted to make it different, right? We wanted to be more than, hey, here's some great information that you get wowed by. We want this to actually be applicable. And this is an evolving type of a course. And this is a conversation that we have to continuously have, because a course is only as good as what you can do with it when you go home. And so what we've created is something where when practitioners go home and actually use this, we're continuing the conversation. So one of the things that we do is that we have a Q&A section where anybody that's going through the course can actually ask us questions while they're in the course, and they're going to be getting that answered in real time. We also bring back all of the scientific team or all the educators in the course to do live Q&As. So we send an email out, everybody asks the questions after they've gone through the course, and actually they've gone and applied it. And then you get to pick the brain of some of these educators that have been practicing clinical longevity medicine. Specifically, this course really goes into the details of peptide therapy and how they're actually utilizing it. So it's continuously ongoing. So it's been a lot of fun so far. We got the first, cohort of people in there. We were really, to be honest, we didn't open it up because we were so overwhelmed by how many people came in the front door. We were surprised by that. And so it's actually, if you go to the website right now, I don't know when this is going to air, but it actually still says waitlist because we're just making sure that we can take care of that first 100 people that came through. But in the next few weeks, we'll be offering it to the rest of the nuBioAge network. But super exciting. This is just the beginning, and it's going to be an ongoing course and conversation that we have about the clinical application of longevity medicine. This one specifically on cardiometabolic optimization, and specifically talking about peptide therapy, even though the first version of the course, Lexi did not let me finish it. She said, "You're missing something. We have to talk about hormones." And I said, "No, Lexi, I want to go into the details of hormones in a full-on course." So she's like, "No, we cannot have this conversation if we don't address hormones." I was like, "Okay, fine. We'll talk about, we'll have a module in there, reviewing hormones a little bit, but we want to get into the finer details in the next versions of the courses." So yeah, super excited. It's been a lot of fun so far, and should be available again for everybody else pretty soon here. Hopefully by the time this is out there.
Yeah. So thank you so much for that, Leonard. I really think that hormones are an integral part of longevity medicine. And so I'm so glad you finally agree. So a teaser, I've gotten to do some of the coursework already. And like, as I'm going through it, I'm like texting all my friends who've taught it. I'm like, this was amazing. This is some of your best work. You need to make an ebook. Like, this is so good. And so I really, especially if you're listening to this podcast and you've trained with me, you've been in my academy, like, this is definitely a course you want to take, in that it is putting a lot of the pieces together that maybe we've talked about. I really enjoyed Chris's lecture on some of the weight loss, body composition, peptides. I texted you and I was like, "Oh my God, I know nothing about sirtuins." And now I have to probably go back and watch that lecture again, just when we talk about longevity and sirtuins and pathways and mTOR and AMPK. And then I'm finishing out a BIDS course right now, which the first lecture was awesome because it walks me through what I call our longevity panel in our practice. So it's literally like, line by line. So again, if you're a practitioner, this is the course that you definitely should consider taking. And then I still have Dr. Yur's lecture that I haven't finished yet. So it's good. It's good shit. It's good shit. So, so what is the next event then that nuBioAge will have so people can plan for that?
Well, I'm not allowed to talk about it, even though I'm really bad at keeping secrets. But we are going to have something very soon, right? So it's going to actually be August 22nd here in West Palm Beach. If you were at Calm, you probably know what it's going to be about. We had some talks, some lectures at Calm where the crowd actually was booing because they wanted to hear more about this one topic. It's a topic that we haven't been able to talk about in a long time. And we haven't figured out all the details yet. I don't want to put it out there just yet. But we are going to have what we call a clinical longevity summit. And it's a one-day event here in West Palm Beach. And it's going to be, we'll be announcing it soon, but it's going to be very exciting. It does have to do with longevity medicine, but we are going to focus on, I guess a hint is this immune dysregulation that we see happening more than people think out there. And it's going to be a lot of fun. We're going to have a lot of special experts, a lot of the people that you saw at Calm. And it's going to be a very unique conference that I'm pretty sure nobody else has done yet. So sorry, I can't say it just yet. I want to make sure I have it right before I announce it out there. But yeah, that's coming up soon, August 22nd in West Palm Beach.
Wonderful. Leonard, where are you presenting next?
I will be presenting next with BioT in Chicago is the next time I'll be presenting. So we always have, and we'll be missing you on that one. Yeah. We always have these pretty amazing one-day peptide certification type courses with BioT, where it's a lot of fun. We get to lecture with Dr. Chris Wusterhausen. And of course, we're taking and kind of doing a cardiometabolic optimization part to that. So we're going to have some cardiologists coming in that are really going to emphasize, cardiovascular disease. I think that everybody needs to be a mini preventative cardiologist out there. And our good friend, Dr. Abid Hussain, is on a mission out there to make sure everybody has at least some baseline knowledge about what it takes to be a preventative cardiologist, because this is one of the things where you can make a really big impact on someone's life for sure. If you're able to identify risk earlier and earlier, and you know exactly what to do about it. And that's something that we go through in the course in the longevity certification. Actually, Dr. Abid Hussain has like 3 or 4 hours in there where he goes really deep into how he analyzes cardiovascular risk with things like Clearly, the lab values that he looks at, the solutions that he has. He goes in pretty deep. And so I think that's going to be a big subject for the rest of the year, and one that we'll be talking a little bit more at BioT as well.
That's awesome. That's so cool. So cool. Well, Leonard, thank you so much. We're coming to an end. I know this was like probably one of our quicker podcasts because we didn't banter off. I had two intentions: Regenatides and then longevity certification. So that's awesome. So hopefully by the time this airs, the longevity certification is like able to open up to the masses so more practitioners can get in, because people want it. It's good shit. People want it.
All right. Sweet.
All right. Thank you, Leonard.
All right. Thank you.